Over to Dasen Thathiah. He is in KZN outside the Addington Hospital. I've been watching people queuing up behind you. Tell us what you've been able to find out of the situation there.
Well, Jane, if you're alarmed at that queue that you see behind me, that's not even half of it, because it continues for as far as the eye can see. Now, Addington Hospital was one of those that was originally identified as a hospital which was meant to be dedicated to dealing with COVID-19 in the province. That was when we heard of the first cases. And now, as of last night, with cases standing at about 126,000 in KZN, the numbers continue to rise at Addington, with the patients streaming in, because the hospital is still dealing with many other referrals from other parts of the province as well. Now, I would have liked to have had a conversation with the Health MEC this morning. It was a process that I had started on Thursday to try to get her here. Unfortunately, I found out yesterday that that wasn't going to happen. There wasn't a reason that was given. I then tried to get the head of Department for Health, and that also didn't pan out. I found out at about 10 p.m. last night that I wouldn't have the HOD either. But one of the reasons why I am standing outside Addington Hospital is because it's an example of some of the infrastructure and resource challenges that the department is facing. And I'll bring into the conversation now Mlungisi Ndlovu. He's with the Public Servants Association. Mr. Ndlovu, you were here just a few weeks ago. We're talking about infrastructure challenges, and you were among those that was protesting about the issue of lifts. And as we speak, there's still only about 2 of the 10 that are functioning. But talk to me about what some of the staffers are experiencing inside this hospital.
One of the biggest challenges here is the issues of lift. These challenges has been there for years and years and years. There have been some discussions with the head office in terms of trying to fix their lift. Seemingly, it is not working. So it is for these reasons that we believe as PSA that the department should be open to us, because it's very clear they can't fix the lift. And now we have heard that they've redirected the patients. They are starting to discharge the patients that are stable. And you must remember that this hospital has been in existence for more than 100 years. So it can't fail now. It is for this particular reason to say the staff are frustrated. They've been working under these conditions.
But the lifts are only half of the problem, because we also know that there are issues, for example, with things like wiring and electrical issues in this building as well.
Yes. Our concern as PSA is that this building has not been proper maintained. The maintenance, because there's issues of leaks in certain roof, in certain department, like the filing department. So it has not been proper maintained. It is for these reasons that we really want to ask the question from the department: what happened in the past years in terms of the budget for infrastructure? Because
that's also a question that I would have liked to have asked the MEC, but as I mentioned, they didn't accept our invite to be here. But you're talking about something very interesting, because recently we saw that the department was wanting to have refresher training with the hospital CEOs and finance managers to handle budgets like you're talking about. But then we also know that there's been irregular expenditure in the department. So how has that impacted on ensuring that the public gets the services that they need beyond Addington Hospital?
All irregular expenditure, whether it's Department of Health or Transport, it has impact on the public service. You must also understand that in this, the very same hospital, they've got budget in terms of the replacement of the lift. The lift should have been replaced in September, but that has not been done. So irregular expenditure always contribute to that effect. And our concern as PSA is that there is legal action that is taken against CEOs and some of the chief directors in certain departments who are failing to take accountability in terms of how they spend their budgets.
Mr. Ndlovu, I just want to wrap here quickly. So with all of this considered, how prepared then do you think we are to deal with a potential second wave?
So the second wave is that you have seen how we have started. It was PSA on record to say the department were not ready, but now the department seem to other departments have dropped the ball in terms of COVID, because some people are not complying. They are not being given a certain PPE, and you see the movement, and yes, you see the queue. How many people are here in the queue? And it's put a lot of stuff at risk. That is for this reason. Whether it's Home Affairs, whether it's transport, they should be able to up the game, because we're not sure what's there's going to be an impact in terms of this COVID-19. It is for this reason that we are saying they must improve infrastructure. They must also employ staff, because it seems as if we are understaffed and we are under pressure. So those are the challenges that we have. We're calling for the department, and also not to be hostile into the media. If the media say come and account, because we want to be part of the solution. If they're running away from being accountable, we have a problem. As PSA, we want to defend our members. We want to defend to ensure that we provide the service to the public.
Thank you very much, Mr. Ndlovu. Some serious concerns then coming out of Addington Hospital, some of those that we have also seen for ourselves during a visit inside the facility.
And Dasen, I hope you do get word from the MEC and the HOD, because they also need to be reminded that they are servants of the state. As taxpayers, we pay their salaries, and they are answerable to us when we have these pertinent questions. Let's go over